My name is Dr. Basit Rahim, and I'm the medical director for stroke and neurocritical care at, at Mission Hospital. So let's get started. So just a brief introduction about Mission Hospital. We are about a 523 licensed bed. We're in between Mission Hospital and main campus here in Mission Viejo and then Laguna Beach as well. We are the largest medical facility in Orange County, and we treat on average about 80,000 people, patients annually through our emergency department. So our throughput for the emergency department is very remarkable, actually. So we are a stroke receiving center, and we are a joint commission certified comprehensive stroke center. So that is the highest level of accreditation that we can get for a stroke center. So we can take care of, bread and butter stroke cases and also very complex stroke cases here as well. We have great number of physicians, neurosurgeons, stroke doctors here. So just quick facts, and then we'll get into prevention and risk factors. So one American dies of stroke every 4 minutes. It's quite a lot. And we made a lot of advancements over the last few years in stroke research and getting getting stroke down to the 5th leading cause of death in Americans. Usually it was in the 1st or 2nd, and also the 1st, 2nd in disability as well. It is very high up there because a lot of strokes cause a lot of disability now rather than causing the patient to pass or die from it because of all the advancements that we've had in stroke care. So what is a stroke? Hands down, stroke is a medical emergency. Okay, so stroke is an umbrella term. It's divided into 2 different types of stroke: ischemic stroke and hemorrhagic stroke. So the ischemic stroke just means a blood clot has traveled to the brain, or there's a blockage in the brain. And that is lack of oxygen because of lack of blood flow. And that accounts for majority of the strokes that we see, about 85%. Nationwide, that's the most frequent type of stroke. Hemorrhagic is the bleeding type of stroke. Now, the hemorrhagic is basically a blood vessel that ruptures, an aneurysm that ruptures, and that can cause brain injury and subsequent neurological injury and deficits as well. So breaking it down, ischemic is the number 1. Hemorrhagic is a low component, but hemorrhagic itself does cause a lot of disability in that. So this is a picture representation of both. The left diagram or the video on your left side. It represents a ischemic type of stroke. So here you see as the blood clot travels to one of the branches of the blood vessel, and it stops and it creates that gray zone that appears. That's the stroke developing. And basically it's because that clot just stopped blood flow. Doesn't lack oxygen to that area that the artery feeds into. So that's on the left side. On the right side, we see a zoom in on one of the blood vessels, the red being the artery, and the artery is high pressure. So if there's any injury to the blood vessel or you have a lot of high blood pressure, then that artery just cannot sustain that stress and it can rupture. And that rupture causes adjacent area to be injured in the brain and can cause a blood clot, a large pool of blood in the brain. And that can cause neurological injury as well. So in essence, the stroke is an umbrella term, and then we can divide it into ischemic and then hemorrhagic.
Is it volume?
So symptom, what are the symptoms of stroke? It actually depends on the part of the brain that's injured. So I can have injury to my left side of the brain and then cause weakness in the arm, numbness in the arm, or speech deficits. I can have a stroke on the right side and cause left side weakness, or back part, which can cause vision deficits. So the most common symptoms of stroke, for the purpose of this talk, is sudden numbness and weakness of the face, arm, and leg in one side of the body. Typically occurs one side of the body. And inability to talk, slurred speech, and also understanding. So if somebody's talking to you and you cannot comprehend what they're saying, that's also an area of the brain that's injured, or lack of blood flow for developing a stroke. Vision loss. Vision has a dedicated area in the brain. So, and a stroke there can cause vision loss as well. Dizziness, loss of balance, and unsteady gait, which is walking, that can occur as well, especially in the back part of the brain here. And then severe headaches. Severe headaches are more common in the bleeding type of stroke, the hemorrhagic strokes. It's sudden onset that you cannot, somebody that doesn't get headaches often, or it's different from their typical headaches, and sudden onset and severe. So is it possible to prevent a stroke? Actually, yeah. 50% of all strokes are preventable, and it just requires us to go to our doctor, look at our risk factors. And I'm going to break the risk factors down to two different types. And one are what we call, as physicians, we call them non-modifiable. And what that means is uncontrolled. And no matter what I do, it's unfortunate that risk factor does not go away. And then there's modifiable ones, which are controllable. So controllable ones like cholesterol. I can take a medication and bring my cholesterol. I can do a diet and I can bring my cholesterol. So let's get deeper into it. So uncontrollable risk factors, things that I cannot control, things you cannot control, but they add to risk of stroke. Age, unfortunately, is one. And stroke can actually happen at any age, but incidence increases as you age. And the stroke incidence doubles for each decade after 55. Unfortunately, we don't stop aging, so our risk of stroke does get more and more as we age, just like a heart attack. Gender or sex, nearly 60% of stroke deaths are in women, and stroke does kill twice as many women as breast cancer, and incidence is higher among women because women live longer than men, and there's a higher rate in the younger female population as well, and that can be linked to a few different things like oral contraceptive use, hormonal effects, and postpartum state. So after delivery, female can be more procoagulant. What that means is that ability to form a clot. So that skews the population a little bit in the younger population to more towards females. And race and ethnicity. African Americans have double the incidence of stroke compared to their Caucasian counterparts. Hispanic, Latinos, and American Indians also have a higher risk, but it's less than the African American population. And the reason of this racial disparities is the higher prevalence of hypertension or high blood pressure, diabetes, and obesity in that population. Okay. And at the end, we'll look at a map of the United States where we see a lot more stroke in our community here. And genetics, genetics is something that we can't control. So some controllable risk factor also. And there's multiple genetic disorders that increase your risk for stroke, like sickle cell, lupus. And some of these disorders directly affect the brain. So they're primarily, you have a disease that affects the brain, and unfortunately you have a stroke. Or you can have a general body disease like lupus, and it increases your risk for stroke subsequently. And I just mentioned that sickle cell is an important cause of stroke as well. We don't see a whole lot here in Orange County, but it's quite prevalent throughout the country. So we talked about the uncontrolled risk factors. Now let's talk about the controllable risk factors, which we call modifiable. Things that we know are risks for stroke and we can actually help improve. And this is where, 50% of the time when strokes are preventable because of these risk factors. And we're going to go over them in detail. And then we can talk about them at the end if you have any questions. So what I want to highlight is high blood pressure. High blood pressure, hands down, is one of the leading causes of stroke. The ischemic type and the hemorrhagic type, both. And regular blood screening with your doctor and receiving appropriate treatment, including lifestyle modification and medications, are recommended. I see a lot of young strokes, young folks, young patients with strokes, and the only thing that's abnormal about them is they just had abnormal high blood pressure for an extended period of time. They haven't gone to the doctors, or they have diabetes, and because of that, they have high blood pressure. So what we recommend long-term, especially in heart disease and stroke disease, is blood pressure less than 140. If you're diabetic, it's less than 130, actually. Okay. That's the top number, the systolic. And these levels at higher levels, the levels below 140, they're associated with lower risk of stroke and cardiovascular events. So this is the first slide of the controllable risk factors, and I put high blood pressure as number one, because that, in my opinion, is one of the top leading causes of stroke, especially as you age. Smoking, now that's a controllable risk factor. Now, smoking promotes inflammation, reduces your oxygen level in the body. It increases the clotting mechanism in the body. It basically damages your organs. The organs age more faster. They just take on an injury because your blood vessels to that organ are also damaged, and it lowers your good cholesterol, and it raises blood pressure. So it's like everything in one slide. Just if somebody is smoking and they have a risk, that's a risk factor for stroke. And I always ask all my patients that come in with a stroke, do you smoke? I don't know if they're telling the truth or not, but usually they say no. But I'm like, when I look at all the risk factors, if they don't have high blood pressure, then I ask them again, is there smoking involved? Usually, they'll tell me that, yeah, they either smoke marijuana. And actually, there's recent studies that show marijuana smoking chronic increase the risk of stroke as well. Diabetes. So diabetes is a full body type of disease. It also promotes inflammation. It increases your blood pressure, and it impairs normal function of your good organs. You see the image on the right side. Diabetes not only affects stroke or brain, it actually affects pretty much every other organ in the body as well. Peripheral neuropathy, diabetic foot, bone disease, liver disease, renal, kidney disease, liver disease, all that. So diabetes is just basically, it promotes inflammation in the body and overall blood vessel health, and it can lead to stroke as well. And then we always talk about cholesterol. Cholesterol is one of the key factors as well in reducing the amount of stroke, risk of stroke. So cholesterol becomes the agent that helps in clogging the arteries. So when you have a lot of cholesterol, you promote the clogging of those arteries. Now, if you look at the diagram on the right side, you have a normal artery that doesn't have any clog, but then you have this cholesterol buildup in the section of that of an artery, and that yellow part, the yellow little area, it represents that it's developed a clog there, and you can tell that blood flow is going to be diminished on the right side compared to the normal artery. And this happens everywhere. A lot of people get it in what we call peripheral vascular disease. They get decreased blood flow to the legs, or coronary artery disease, which cause heart attacks. But if it happens in the brain, it causes strokes. So in a way, it's a brain attack, a stroke. And so basically, a lot of people say that I'm going to control the diet. Diet helps quite a lot. Diet helps your good cholesterol, and that good cholesterol will lower your bad cholesterol. That does help. But if you have risk factors for stroke, like we talked about with high blood pressure, diabetes, it may be you may need medication on top of it to help your cholesterol. And then once you get to a good cholesterol level, and you reduce your risk for the others, like high blood pressure and diabetes, are as well controlled, and you quit smoking, or if you are smoking, right, quit, then you can go into diet control as well. I know a lot of people don't like taking medications, but in this, we have clinical trials and studies that show that Lipitor and Crestor, which are a class of medication called statins, they reduce your risk for stroke significantly. And those are not always bad medications. They have side effects, but I think sometimes the benefits outweigh the risk of the medication, especially if you have all these other risk factors. So another important risk factor for stroke is atrial fibrillation. Atrial fibrillation, in a nutshell, is basically an arrhythmia or irregular heartbeat. And basically, what happens is that the rhythm of the heart is desynchronized, and that can cause, because these are different compartments of the blood flow, and if the blood flow gets altered, you can actually form clots in the heart, and these clots can actually dislodge and go to the heart or go to the brain, because 30 to 40% of all blood flow from the heart actually goes to the brain, and it's the first exit off the artery that comes out of the heart. So that's why stroke and atrial fibrillation go hand in hand. And we reduce the risk of these strokes from atrial fibrillation putting the patient on blood thinners. And these blood thinners are warfarin, which is also Coumadin, Pradaxa, Xarelto, and Eliquis. I know I've seen a lot of commercials for Eliquis around, but yeah, they help reduce your risk of stroke significantly. I have patients that come in that hold blood thinners for a procedure, maybe a dental procedure, or any type of surgery. And while they hold the blood thinners, they develop a stroke. And that happens, I see, because I'm a stroke doctor, I see that quite frequently, but it doesn't happen all the time. It's pretty safe to hold your anticoagulation for a short period of time, as long as an advisement from your doctor and for a procedure. And you always have to look at your risk and benefits of any procedure once you hold your medications for atrial fibrillation. So if you have palpitations of the heart, and if you have risk factors for stroke, or you've had a TIA, which is a mini stroke in the past, this is an important component to talk to your doctor about. So when we look at atrial fibrillation, how does that correlate to your risk of stroke? And we have a scoring system that we use, but I'm going to just touch base on it. And if you and we call it the CHAD score, the CHAD-VAS score. I don't need you to remember that, but it's just the names that we use for the scoring. And what happens is that if you have atrial fibrillation and then you have another risk factor, you just start adding points. So you have atrial fibrillation, and then you have high blood pressure, add a point. You have congestive heart failure, add another point. If you have diabetes, add another point. And you have a previous stroke, or you're female, you add a point because female has more prevalent, especially in atrial fibrillation. So if you have 2 or more points, your doctor should recommend that you should be on one of those medications we talked about, like Eliquis and warfarin, because your risk for stroke is quite high. So as you add up, so these are cumulative. So if you have more and more and more, the risk of stroke goes up. And then look at carotid disease. How can we screen for your reduction of risk? But you have 2 blood vessels that go up to the brain called the carotid arteries. You have 2 in the back called the vertebral arteries, but the carotid arteries are the major ones in the front. And if somebody comes with a stroke or symptoms of stroke or a TIA, we always look at their carotids as well and see, are they narrowed? Are they blocked? What's going on with that patient? So we look at the carotids. If I see a narrowing in the carotid, I look at it, is it asymptomatic or is it symptomatic? Asymptomatic just means that they have a narrowing, I found it, and they don't have a stroke from it yet. So what we do is we do medical management for that. Aspirin or Plavix. We'll talk a little bit more about those medications. And we monitor and we look at, subsequently we'll see, has it gotten worse, better, what? But if it's a symptomatic narrowing, meaning that a stroke occurred because of that narrowing, and if you see the little diagram on the right side, I've highlighted where the narrowing can be. You see the blood vessel is healthy up to a particular point where it gets very narrow. Just like a highway being closed. And basically, if that causes a stroke, we call it symptomatic. And that's a symptomatic narrowing. That means that medical management may not be enough. And that requires us to do surgery. And the surgery is carotid endarterectomy. And that is basically a surgical intervention here where we just take get rid of the segment that has the clog in it. And then the other thing that we can do is a carotid stent. And the stent is basically we go through the groin area, just like a cardiac catheter going up, and then we deploy a stent to open that artery up. Now, the carotid stent is less invasive than the carotid endarterectomy, but they all have the risk and benefits and which one's better and which patient. It's all about risk factors. And if you do have some narrowing in the carotid, a specialist like a neurosurgeon or a vascular surgeon or a neurologist should evaluate the proper management of that disease. Other factors, I wanted to highlight all the other factors in detail, but a few other factors that I do want to talk about is sleep apnea, migraines increase your risk for stroke, replacement hormones can increase your risk for stroke, substance abuse, especially alcohol, excessive alcohol. These are all tied to risk for stroke. Okay. So substance abuse, largely in the young population. So maintain physical activity. Exercise, like we said, increase your good cholesterol. Exercise always promotes good health, and it gets rid of the inflammatory state that you may be in, or may from other risk factors. It reduces your blood pressure overall, cholesterol, helps with obesity, and improves sleep, which is all good factors to prevent stroke. And, when I talk about stroke, it's also generally heart disease as well. So now we talked about risk factors. We can always work on risk factors to reduce the stroke, the risk of stroke. However, we may need extra assistance. And this is where blood thinners come into play. And the main blood thinner that we talk about is aspirin and Plavix. And there's a new contender, Berlinta, as well. Recent studies show that that helps in stroke patients, but it's just very expensive. Aspirin you should just buy over the counter. So they do reduce your risk on top of all the other risk factors that we talked about. It reduces your risk quite significantly. And then if you have atrial fibrillation or a clotting disorder, then the other medications we talked about, warfarin, Eliquis, Xarelto, and Pradaxa, are very important. Sometimes we do a combination of the two, like aspirin or warfarin, aspirin or Eliquis, depending on all the risk factors. Okay. Now, we talked about reduction of risk of stroke, and I just want to touch base on, let's say if a family member or loved one or has a stroke, what can we do about it? So time is important. The time to coming to the hospital is very important. And what we say is time equals brain. So the faster you get to the hospital, the faster we can get to the treatment of that clot or that hemorrhage. In treatments for ischemic stroke, we have a medication called, in layman's terms, clot buster. We call it alteplase, and we recently started a new medication called tenecteplase. And these are medications basically like, Drano, basically for the arteries. Basically, it promotes dissolving a clot in the brain that may be causing a stroke. Now, if that's number one treatment, that plan A, and then plan B is the thrombectomy. What we look at when somebody comes in with a stroke, we look at all the blood vessels immediately, and we look where the clot may be. And if we can identify a clot and the artery is big enough, we actually go with these special catheters all the way up to the brain, and we try to aspirate or try to take the clot out. And that's a procedure that we do under general anesthesia or sometimes even awake patients where, and that helps quite significantly. So clot buster, and then if that doesn't work, then we go into thrombectomy. Usually simultaneously we do both these days together if the artery is feasible for us to go in and retrieve that clot. And treatment for hemorrhagic stroke. So basically, if you can see that, a blood vessel in the brain that ruptured, it ruptured because it's getting a lot of pressure. So high blood pressure is one of the causes for a brain hemorrhage. And what do? We control blood pressure. Getting somebody to the hospital, getting that blood pressure down is key. And that subsequently it promotes not that the blood clot or the hemorrhage doesn't get worse. And if the hemorrhage does get worse and it's causing more injury to subsequent areas or nearby areas, then we can do surgery, actually, either take the clot out or relieve pressure from the brain. Okay. So, Mission Hospital, we're a comprehensive stroke center, so we are able to treat all these complex stroke cases that do come to our emergency department or as transfers. So in conclusion, stroke can, take away points. Stroke can occur at any age. It's just that risk factors start to accumulate as you age, and cholesterol and smoking and things like that. There's risk factors that we can control, some things we cannot control. So we can work together and modify these risk factors. And that's why we call them modifiable risk factors, where you and your doctor can actually talk about high blood pressure, smoking, cholesterol, diabetes, and obesity, physical inactivity, and poor diet. So a lot can be done from your end to prevent stroke. And those are the risk factors that I want you to understand that, you and your doctor should come to look into to reduce your risk of stroke. And here at Mission Hospital, we can actually help you as well. If you have a loved one or you've had a previous stroke or a a previous mini stroke or TIA. So your doctor will help identify, evaluate, and reduce your risk factors. They'll put you on proper medications if you require it. And we also look at your blood vessels. Like, we looked at the carotids and look at the health of those carotids and other blood vessels that go to the brain and see what your risk of stroke stands. So this is a nutshell of, I put it in here. So if you're looking at this as a recording, you can look at it of all the risk factors that are placed in one area. So losing weight, less alcohol, low amount of sodium, eating healthy and exercise. These are lifestyle changes that you can do. And then from a medical standpoint, you can reduce your blood pressure, cholesterol medications, reduce your cholesterol, and then atrial fibrillation you can treat with medications, and also cardiologists may be required as well, and then diabetes. Okay. So we have this acronym BFAST to basically sum up what symptoms of strokes are, and I want to go over them very quickly. And BFAST, it's B stands for balance lost, and then if there's sudden loss of balance, that could be a sign of stroke. Eyes, E for eyes, the blurring or vision loss. Facial droop. For F, A for arm weakness. It shouldn't be just arm, but it should be leg as well. But I don't know where the L goes here, but speech difficulty for the S, and then the T is for time to call 911. Time is very important because the faster somebody gets to the hospital, the faster we can deploy treatment. And if we need to get the clot out or give the clot busting medication. So time is very important. And there's certified stroke centers, and then there's stroke receiving centers, and then so it's important that you go to a stroke center if you suspect a stroke.
A stroke center.
And so here's the diagram of the country that is broken down into the counties. Oh. These are stroke death rates from 2017 and 19. These are populated by the CDC.
To the East Coast.
And
what?
And basically it looks at where the population with the highest risk of stroke is. And you can tell it's the lower half of the country on the eastern side. And this area actually has a name. It's called the stroke belt, actually. There's a high prevalence of stroke, incidence of stroke in those areas.
Oh,
and I don't know if it's ethnicity based, racial, or okay. So you see our Orange County here. We're in the we're not very high in the amount of strokes that we get, but we get a good amount in our hospital. So this is an interesting map to look at. And that's the end.